Hello everyone. Welcome to our comprehensive guide on the different types of progress notes used in mental health, developmental disabilities, and substance use care. Documentation is essential for effective treatment, continuity of care, and accurate communication. Today, we'll walk through the various progress note formats and how to use them effectively. Let's dive in. Progress notes are fundamental in documenting the client's journey through care. From assessment to discharge, these notes help professionals accurately record interactions, interventions, and responses. The five main types of progress notes we will cover are SOAP, DAP, BURP, PI, and narrative notes. Let's explore each one in detail. First, we have SOAP notes, which stand for subjective, objective, assessment, and plan. This structured format is popular for its clarity and consistency. Subjective captures the client's statements, reported symptoms, and experiences. For example, client reports feeling anxious and unable to sleep. Objective observable data such as the client's appearance, behavior, or physiological measurements. Assessment the clinician's interpretation of the client's current status, including diagnostic impressions. Plan recommended interventions, treatment adjustments, or follow-up sessions. SOAP notes are ideal for clinical settings requiring precise, organized documentation. Next up, we have DAP notes. This format stands for Data, Assessment, and Plan. DAP notes are slightly simpler than SOAP notes and are often used for routine sessions. Data includes objective and subjective observations. Assessment provides clinical interpretation and evaluation of observations. Plan outlines goals, strategies, and next steps in treatment. DAP notes are user-friendly and help maintain consistency in the documentation process. Now, let's talk about BURP notes, which stand for Behavior, Intervention, Response, and Plan. This format is commonly used in behavioral health and developmental disability settings. Behavior describes the client's behavior, including triggers and symptoms. Intervention outlines the strategies or techniques used to address the behavior. Response details how the client responded to the intervention. Plan provides recommendations for future sessions or interventions. BURP notes are excellent for settings where tracking behavioral responses is essential. Now, let's look at PI notes, which stand for Problem, Intervention, and Effectiveness. This format is highly useful for documenting targeted issues and their corresponding interventions. Problem clearly identify and describe the issue being addressed. This could include the client's symptoms, challenges, or areas of concern. Intervention describe the therapeutic approach used to address the problem. This may include guidance, resources provided, or therapy techniques. Effectiveness evaluate how well the intervention worked. Was the problem resolved or improved? What is the next step? PI notes are particularly effective for solution-focused documentation and tracking progress over time. Finally, we have narrative notes. Unlike structured formats, narrative notes offer a free-form approach to documentation. They allow clinicians to provide detailed descriptions of client interactions, responses, and interventions without rigid guidelines. While these notes can be useful for complex cases, their lack of structure can make them difficult to standardize. However, when detail is essential, narrative notes can be invaluable. So, how do you choose the right format? The answer depends on your clinical setting, client needs, and agency requirements. SOAP notes provide clarity and consistency. DAP notes simplify the process. BURP notes are excellent for behavioral tracking. PI notes are great for problem-focused interventions, and narrative notes offer flexibility for complex scenarios. Understanding the different types of progress notes is critical for effective documentation. Accurate records ensure quality care, support clinical decision-making, and improve communication across teams. Thanks for watching.